Good day everyone. So today we will be assessing the neck. This procedure involves a comprehensive evaluating of its various structure and function, including inspection, palpation, range of motion, and strength testing. So first we have the objective. Objective number 1, to assess the structure of the neck. Objective number 2, to to detect abnormalities or diseases and or dysfunction. And 3, to assess if the neck is properly functioned. So, safety and security measure, hand hygiene. Second is proper body mechanics. Number 3, wear proper equipments. Pre-procedural preparation, wash hands, introduce yourself to the client, and identify the client's identity, and explain what you're going to do and why it is necessary and how can client cooperate. And 3, provide privacy. Okay, sir. So, karon sir is mag-inspect ko sa imuhang next, sir. So, ako din si Vic Anthony Alas, sir, and I will be your student nurse for today's shift, sir. So, may I know your name, sir?
I'm Clark Alger na last, sir.
Okay, Sir Clark. So, Sir Clark is, karon is, mo-follow lang ka sa akong mga instruction throughout the procedures, ha? And ano kayo mga question yung mga asa mo, ha? And pag magsabat lang ka na ako if na kayo mga discomfort na mabatian. So, let's move on to the first procedure. First procedure, inquire if the client has any history of the following: any problem of neck lumps, neck pain or stiffness, when and how and the lumps occurred, any diagnosis or thyroid problem, any treatment such as surgery and radiation. So, sir, first, before ko mag-assess sa imuhang neck, sir, is mga tanan lang ko about ani mga answer is, na ba kayo mga hubag-hubag diri, sir?
Wala, sir.
Sabay sakit diri, sir?
Wala.
Na ba kayo mga treatment na gina-apply para maulin yung diri?
Wala.
Okay, so the client didn't have any of the history. Check the neck muscle for abnormal swelling or masses. Ask the client to hold the head erect. Observe the movement. Ask the client to move chin to the chest to determine the function of the muscle. Move head back so that the client points upward. So, sir, i-inspect sana ko yung mga neck muscles, sir, ha? And palihog ko hold and itaas and up and down na yun, sir. So, okay. So, the client can freely move. 6. Move head to the ear so that move towards the shoulder. And turn head to right into the left to determine the sternocleidomastoid muscle and assess the muscle strength. Then step number 9, ask the client to move his head against the resistance of your hand. And step number 10, shrug the shoulder against the resistance of your hands. So, sir, palihog lang po ka ng laser, the pikas, and palihog ko pangusog being diri, sir. Okay, pikas ang sir. Okay, so paano, sir, palihog pangusog isa kayong shoulder. Okay, so the client neck and shoulder muscle is okay. I detect no abnormalities. So let's proceed to the next procedure, which is the lymph nodes. Lymph node. First, palpate the entire neck for enlargement of lymph nodes. So, okay, sir. Mag-palpate na ko sa inyo nodes, sir. And pagsaba, sir, if na kayo ma-detect ng mga sakit. Ano, sir? So the client didn't react to our palpation, which means that there are no abnormalities in the neck. So let's proceed to the trachea. Hit the trachea for lateral deviation. Place your finger or thumb on the trachea in suprasternal notch. Then move your fingers laterally to the right space bounded by the clavicle and the entire sternocleidomastoid muscle and the trachea. Sir, magsulod na ako. Wait, sa trachea, sir, ha? Ano, sir?
Dikit.
May sakit, sir?
Wala.
Mas ganito, sir.
Wala.
Okay. So the client didn't react to our palpation, which means that the trachea is normal and no abnormalities. Proceed to the thyroid gland. Inspect the thyroid gland. Stand in front of the client. Observe the lower half of the neck overlying the thyroid for symmetry and visible masses. Ask the client to hyperextend head and swallow if necessary, and ask the client glass of water to make easier for the client to swallow. Palpate the thyroid gland for smoothness. Note any enlargement masses or nodule. Auscultate the thyroid gland for bruits. Use the bell shape of the diaphragm for stethoscope and document findings. So, sir, karon is inspect ako sa imong thyroid gland. So, mag-inspect ako na, sir, ha? So, the thyroid gland is okay during my inspection, and during my observation on the half of the neck, it's okay, and I don't see any visible masses. Then, pag hyperflex na, pakipaliw kung hyperflex sa imong head, sir. So, kayo ana and swallow. Okay, so normal lang yung pag-swallow, which means there are no problems or any enlargement on the thyroid. So, next is palpate the thyroid for smoothness. Note any enlargement or masses or nodules. So, palpate ako sa thyroid, sir, ha? Okay. Sir? So the thyroid is okay, and I didn't suspect any enlargement, and we move on to the auscultation, which is I don't have any stethoscope, so let's skip that and document the findings. So overall, the client's neck is normal.